Honestly, Dad, I can't think of a better way to start out every week than to come out here and walk with you in the morning.
I know, Seth, and it definitely keeps me in shape in my old age.
Sure does.
Son, I'm going to be honest with you. I'm getting really tired and I can't keep up today.
What do you mean? It's only been 2 laps. We usually do 6.
I know, but I'm having a hard time catching my breath.
All right. If you want to stop, we'll stop. Don't want to push your body in your old age these days.
All right, I'll stop.
Dad, you've been really weak for weeks now, and it looks like your legs are swelling up. Please go to the doctor for a checkup.
Oh, stop, I'm fine. Now let me go upstairs and rest up for our walk tomorrow.
All right. I'll see you tomorrow. Be careful, Dad.
I'll be fine.
Dad? Oh no. I gotta call 911. 911, please hurry. I think my dad fainted on the stairs.
Sam, I'm your nurse today. We're going to run a few tests to try to figure out what's going on, but first I have a couple questions to ask you. Your chart says that you've been having some unusual fatigue and shortness of breath. When is this occurring?
It occurs whenever I try to walk or exercise.
Do you exercise often?
Yeah, I go on walks occasionally.
Well, that's good. You aren't obese. Do you smoke?
No, I do not.
Well, first we're going to run a stress test on you. This will help us identify rhythm changes during exercise. After the test, we'll typically perform an ECG to hopefully improve the accuracy.
Okay, do whatever you need.
Perfect. Let's start with the stress test. Please just get on the treadmill and start walking until I say stop. Alright, you can gradually increase the speed. Okay, is that a comfortable pace for you?
Yep.
Alright, let me know if you're feeling any claudication or shortness of breath.
Sounds good.
Hi Sam, I'll be your doctor for today, and after looking at your tests, the result of your ECG and stress test show some ST segment depression, which is a sign of heart failure. Specifically in your case, left-sided congestive heart failure. Were you aware that you exhibit a congenital heart defect?
No, I've never been told.
Okay, well basically that means that you have had this heart defect since you were born. Our tests have detected a condition called aortic stenosis. This means that the opening of your aorta is smaller than normal and is put under much strain. I know this may seem impossible since you've gone your whole life without knowing, but it happens to many people. In order to help your condition, we're going to put you on a few medications and suggest some lifestyle changes.
Well, what does that exactly mean? I don't want to be put on meds. It's not like I faint every day. Can I just live with it?
Unfortunately, you need to get treated immediately. Heart failure is something that consistently progresses with time, and it just worsens the more that you ignore it.
What does that exactly mean? How does it actually affect me?
Well, with heart failure, your circulatory system is immediately impaired. Your body tissues and organs are not being supplied with the necessary amount of oxygenated blood for their normal function. Specifically with your condition, your left ventricle is impaired. This is important because the left ventricle supplies your whole body with blood.
Was that the only thing that it affects? Just my circulatory system?
Again, unfortunately, no. Your circulatory system could arguably be the most important system in your body. If it is impaired, like what we see in your condition, most other systems are impaired.
Like what?
Well, for example, your respiratory system is affected. Since your heart is unable to pump a normal amount of blood out, it will begin to back up in the lungs, which ultimately causes congestion. Your urinary system is also infected. Typically, with a decreased blood flow, your body will want to send the blood that it can to more important organs, such as the brain and heart, which will result in insignificant supply of blood to the kidneys. Your body holds onto more fluid, and that will explain the swelling of your legs and feet.
Oh, now this is starting to make sense.
So for medication, we have a couple options. Here's what I'm thinking. I'm going to put you on a diuretic, which will help you reduce dyspnea and signs of water retention. With diuretics, just so you're aware, some side effects you may be prone to include dehydration, gout, skin rash, and increased urination. You're also going to be put on a beta blocker, which will help lower your blood pressure. Some side effects with this include fatigue, nausea, possible swelling in your feet and hands, and possibly cold feet and hands. You're also going to need to take a blood thinner in order to prevent blood clots. Does this all make sense to you?
Mm-hmm.
Okay. I also want to be sure that you're making healthy lifestyle changes. You will need to make sure that you're drinking plenty of water and monitor your salt intake. Keep going on your walks, and when you're feeling up to it, make sure you let us know if there's any changes in your fatigue, chest, and leg pain, or shortness of breath while exercising. Hopefully all these changes will suppress your symptoms. However, if you're still experiencing anything, please let me know.
Okay.
How have you been feeling lately, Dad? Last week you said you were getting lightheaded.
Well, I have been feeling weaker recently, but I'm sure it's just my old age.
Are you sure you can do this? I don't want you fainting again like you did
Would you
before.
stop worrying so much? I'm sure the medication will work for me.
Alright, but if you start getting weak at any time, we'll stop right away.
Seth, you are so relentless! Oh, jeez. Oh, jeez.
Dad? Dad?
Ow.
Dad, no! You okay? I'm calling 911. 911, my dad's having a heart attack. Get here soon. Psalm 41:3. The Lord will sustain him upon his sick bed. In his illness, you restore him to health. Dear Lord, please keep my dad safe and be with him and the medical staff. Please help him bring us the proper medical treatments that will make him feel better and cure him of his symptoms. Amen.
Hi Sam, I've been looking over your chart that Hope sent me, and it's clear that the medications aren't working as well anymore. There are several options going forward, and one that I really encourage you to try is stem cell therapy. Currently, there's a lot of research and clinical trials occurring in which stem cells are used to regenerate the myocardium, the muscle of your heart that is congestive heart failure is killing.
How does it work? Would I need surgery?
So the stem cells will be utilized, are collected from your bone marrow with the same standard procedure that bone marrow transplants occur. And these cells are injected into your coronary artery by a catheter during angioplasty. In most cases, it won't even need general anesthesia, so you'll be awake with just local anesthesia used where the catheter is inserted. It's a relatively simple procedure. Many patients stay overnight to be monitored, but overall, they have no adverse effects noted from clinical studies that have been done previously.
Is this a sure fix?
Not necessarily. It's shown better short-term effects than long-term, but it's still promising in the long term. According to studies previously conducted, an incidence of non-fatal myocardial infarction and arrhythmias decreased. The benefits seem to outweigh the risk, though it is a fairly simple procedure. It can be done in a short amount of time and shows no adverse effects. I'll give you this article and pamphlet to look things over, and you can call me when you have a final decision.
Well, at this point, it seems to make sense to go with the trial. I'll be sure to talk it over with my son.
Yeah, and we're really relieved that there's more options out there for my father.
Great. Be sure to stop by with the receptionist to schedule an appointment. See you soon.
Thank you.
Thank you.
Hi Sam, I'm so glad you decided to pursue this stem cell therapy option.
Yeah, after further thinking about it, it seems like the benefits outweigh the risks, so I'm going to give it a try.
Okay, perfect. Well, like we talked about, you'll be awake, and you'll have just local anesthetic, so you shouldn't feel a thing. You go ahead and lay down. Local anesthetic over here. Alright, so we're going to begin by inserting the catheter, and we're going to reach the coronary artery of the heart. So I'll be using this x-ray image behind you to show where we're at. And then once we reach there, we'll be inserting the stem cells that we previously collected from your bone marrow and directly into the artery. So just let me know if you feel any pain, okay?
Sounds good.
Alright, we're all done, Sam. We're just going to remove the catheter, and then you'll be back in your room for observation. Alright, Sam, how are you feeling?
Feel great.
That's good. I just have some instructions and guidelines for you to follow post-op. For best results, please make sure that you follow all of these rules. Eat healthy and be sure not to do any strenuous activity.
I'll be sure to look these over.
Sounds good. Have a nice day.
Hey, Dad, I think you should get a smoothie.
No,
Why not? The doctor said you should start eating healthier.
this is ridiculous. I feel fine.
Come on, just get one. We need to get some fruit in you. Be healthy.
Okay, fine. I'll try one.
Thank you.
Okay, let's go outside and get some fresh air.
All right, Dad, take it slow this time. We don't want to have a repeat of what happened last time.
That was one time. Let's just walk the ramps up and down.
All right, sounds like a plan.
Feel great. Feel like I could run a marathon.
I believe I can fly. I believe I can touch the sky.
Hi Sam, thanks for coming in today. How are you feeling?
Much better since the stem cell procedure.
That's great news. I'm glad we could find something to help you. It's great to hear that you feel it working. What we called you in here for today is just to basically follow up with similar tests that we conducted upon your initial admission a couple months back.
Sounds good to me.
Great, so if you would follow me, we'll head to the treadmill and we can start off with the stress test.
Sure.
All right, Sam, just keep walking until I tell you that we're done. Seth, how do you think your dad is doing some of the injections?
I think he's been improving a lot. I mean, he's no longer struggling to go on walks. He's making better eating choices, and he hasn't been complaining about chest pain lately either.
That's wonderful.
It is.
How are you feeling, Sam?
Feeling good.
Don't push it.
All right, wow, this is much better than your previously recorded data. How are you feeling?
Feeling good. Still feeling good.
Okay, you can start slowing down. If you want to come to a table just over here, I'm going to let you rest a little bit, and we'll get your heart rate back down to normal, and you'll be on your way.
All right, sounds like a plan.
Wow, Sam, I am very impressed to see how successful this stem cell trial was for you. I'm glad we were able to find something that worked for you. Do you have any questions for me right off the bat?
Nope, never been better.
All right, well, just remember to keep staying active. Go on your daily or weekly walks with Seth, even if only for 20 minutes. Keep eating healthy, stay away from fried, greasy foods that are high in fat and cholesterol. If you ever have any questions that come up, feel free to get a hold of Molly or myself. Be aware that we cannot cure your disease. However, along with this stem cell treatment and healthy lifestyle, you will be able to live a normal life and can manage the symptoms. Seth, just so you're aware, congestive heart failure has been linked to some heritable factors. It is important to be cognizant of this and be sure to come in for testing early rather than later so we can stop you from experiencing anything as scary as your father did.
Okay.
Thank you for everything.
Appreciate it.
I know something. It's definitely used to be in shape.
In your old age,
In my old age.
You're an old man.
I believe I can fly. I believe I can touch the sky. I think about